Hello everyone, in this video we have Dr. Anirban Kundu with us, who is a senior consultant and a senior cardiac surgeon at Shree Aggarsain International Hospital, Rohini, New Delhi. In this video he is going to talk about coronary artery disease in young people of age bracket 35 to 55 years of age. He will enlighten us on some of the reasons of the disease, then he will move forward with some of the cures and prevention of the disease. So over to you, Dr. Kundu.
Good afternoon friends, I am Dr. Anirban Kundu, Senior Consultant Cardiothoracic Surgeon at Shree Aggarsain International Hospital, Rohini, New Delhi. Today I will be talking about coronary artery disease in the young, that is coronary artery disease, blocks in the coronary arteries that occur in patients of the age group 35 to 55. Now this has of late assumed alarming proportions in South Asia, especially India. It has been found that 10 to 15% of all cases of CAD, coronary disease, are found in this age group compared to 2 to 4% in the Western population. So we can well imagine that an economically productive age group falling prey to such a terrible disease is not a good story for our country's progress and prosperity. Now, certain common factors have been found in this group of patients, mainly the well-known coronary risk factors: smoking, diabetes, obesity, hypertension, and a strong family history have been found to be more prevalent in this age group, especially smoking, which unfortunately is on the rise in this group of patients. And also, this group of patients, young patients, tend to have a more severe form of this disease. They have multiple levels of blocks in the coronary arteries. This makes them more of a challenge for therapeutics, be it either angioplasty or bypass surgery. Because angioplasty, we can only put a limited number of stents to open up the arteries. When it comes to bypass surgery, in my experience, I found that these patients are quite difficult when it comes to surgery, because we have to find a soft spot to put our grafts in the diffusely diseased vessels. And in these patients, since they have such a long expected lifespan, minimum of 30 to 40 years, we have to give them bypass surgeries that will last the entire remaining lifespan. So in this regard, we tend to give them as many arterial grafts as possible compared to venous graft, which last longer. But of course, as the old age saying goes, prevention is better than cure. So rather than bypass surgery or angioplasty, rather than considering them as solutions, we should try and prevent such a situation from happening through means of very simple measures. We have to cut down smoking, we have to live a healthy lifestyle, healthy diet, regular health checkups, a diet rich in vegetables, fiber, no sugary and refined foods, high fiber, high fruits and vegetables, increase our physical activity. A lot of young people now we find obese. A lot of young people are smoking. We should absolutely stop the use of tobacco, and of course regular health checkups. And yes, rest also is important. Adequate sleep is as important as these other measures in preventing coronary disease, which is why we are seeing so many young, apparently fit celebrities suddenly dying in the gym or doing the treadmills. One of the reasons is a stress situation brought about by inadequate sleep and rest, which is also important. So, as far as our country's economic progress goes, we certainly can't afford to have this age group of people fall prey to the scourge of coronary artery disease. So, if we really care about our country's economic progress, we should endeavor to reduce the risk factors as much as possible by the measures I just outlined, and make sure that this does not assume pandemic proportions. Thank you very much.
Thank you, Dr. Kundu, for taking out time from your hectic schedule to enlighten our audience. So this was a very meaningful contribution of yours, which the whole team of Sachibat will always remember. So thank you so much, and please follow the tips given by Dr. Kundu.